of the Media Innovation Center, Aga Khan University, as well as Dr. Alex Awiti, Vice Provost, East Africa, and Interim Dean of the Graduate School of Media and Communications. Ladies and gentlemen, Ms. Njoki Cheke.
Thank you everyone for coming to our webinar. Our guest today is Mr. Irungu Houghton, and Irungu is the Executive Director of Amnesty International Kenya. Amnesty International Kenya has been very actively pressing for the right to dignified healthcare, effective quarantine, and a reduction in violence in policing since the start of COVID-19 pandemic and the curfew. Mr. Irungu Houghton has over 20 years experience in leadership and strategy development, institutional strengthening and expansion, effective management, knowledge management, government, public relations, and media engagement. He has been previously recognized as one of Africa's top 100 influencers and top 10 communicators in Kenya. Mr. Irungu, welcome very much to the third episode of our Understanding COVID-19 webinar.
Alex. Thank you very much, Joki. Irungu, good afternoon.
Good afternoon, Alex, and good afternoon, Joki, and everybody who's joined us this afternoon.
Thank you for joining us. So as our viewers might remember, we want to speak to you about government's response to contain the spread of COVID-19 and their impact on civil liberties and personal freedoms. COVID-19 is a highly infectious disease. It spreads very effectively between human beings, and nearly 3.5 million people are infected as we speak. 250,000 are dead. In our own country, we have 490 fellow citizens who who've been infected. We have 297 active cases of COVID as we speak. We have about 24 people dead, and that's every death counts. What is disconcerting is that there's no cure yet. Governments across the world are scrambling all over the place. They've directed a range of measures to stop the spread of this deadly novel virus. So I want to explore some questions with you that you've been personally involved, and you've been very vocal in both your column in the Standard and also talking to journalists in various media houses. Do you have any concerns about some of the measures that the government has put in place, and why, to prevent the spread of the disease, especially around social distancing?
So again, thank you very much for being for inviting me on this wonderful series that you've developed. And one of the, pre-COVID, we used to say that there are moments which occur like a perfect storm. I think what we can adapt now is that phrase and develop it into something that says we are now in a perfect pandemic. It is multifaceted, it is complex, it is contradictory, and also, I guess it is very, very many times it is actually unclear what's happening at any one particular point. 6 columns in, something like about 50 television, radio, and
Is it
Greetings, and my apologies for that, Alex, Joki, and everybody on the line. Can you hear me now?
Yeah, we can hear you now.
Yeah.
Okay. The electricity went just briefly. So I think I was saying, as Amnesty International, we've had three major concerns over this period. The first is social protection. The second is humane and human rights-based policing of the curfew. And thirdly, the management of the mandatory quarantine centers and the isolation facilities that have been set up for people with COVID or people suspected to have come in contact with people with COVID. You know, at a time like this, you know, it was very clear to many of us that we would probably face the pandemic through two axes. The first axis is the axis of inequality, corruption, and the criminalization of people in poverty. The second axis was democratic leadership, respect for human rights, and public trust. And really, these two axes would be the framework within which we would navigate these very difficult months ahead of us. And I think that axis remains really, the two axes remain really the area of focus for Amnesty International Kenya. At a time like this, people need water, they need electricity, they need shelter, definitely they need electricity, particularly people on webinars. They need shelter, they need income, they need safety, but they also need dignified health treatment. And these five big pillars really are the basis upon which a government will be judged in this period, whether it is Kenya, Ecuador, El Salvador, or the United States of America. I could go on in each of these if you would like, but these would be the three that I would throw up immediately in terms of Amnesty's major concerns at this time.
Okay, so I want to be kind of a little more specific here and ask you about one of the best known measures against COVID-19 in Kenya is the famous curfew. You've alluded to some of those conversations. You've had a face-to-face conversation, well, not face-to-face, but you've shared a panel interview with Mr. Owino, the spokesman for the National Police Service, and you've come out categorically to kind of blame the police for some of the atrocities that were visited on innocent citizens. So what are your specific concerns about the merits of the curfew as has been implemented so far?
So we know globally that reduced interaction, reduced movement helps to flatten the curve, and that this is one of the major measures that are being taken globally to fight the virus. In the context of Kenya, the announcement of the curfew initially struck us as an odd approach, because most of the time, you know, that's probably the time when there's least interaction, which is these hours between 7 p.m. and 5 a.m. But obviously it has a crime management quality to it, which is the sense that if people are stuck in and the police are having to manage multiple dynamics, having people in their homes assist that process. Our major concern has really been on the brutality and the excessive use of force that the police officers have used during this period. You know, up to about 3 days ago, the Kenya National Commission for Human Rights had recorded 117 complaints from 15 countries, and something like there is a 3-to-1 ratio of men to women who have been attacked and either fatally you know, have died or have been seriously injured by police officers. The Independent Policing Oversight Authority is currently handling no less than 18 cases of fatalities and tens of injuries. Human rights organizations like Amnesty, IMLU, and others have documenting at least kind of 40 cases of torture and disappearances. So there is a real challenge, I think, in terms of distance-conscious and human rights-based policing in this period. Now, the first thing to note is that actually this is not a new phenomenon. The criminal justice system, that is the police, the courts, and the prisons, have always over-criminalized poor people. Something like 2 million people every year are processed through our court system. Many of them are petty offenders. Most of them are under the age of 35, and most of them will not have legal representation. So the bigger concern is at this time, how do we prevent the system from essentially generating millions of petty offenses or hundreds of thousands of petty offenses that we cannot jail nor can we detain without over jeopardizing the physical distancing guideline. The second one really is, police violence, which is a cultural phenomenon within the police. It is not the action of a few rogue officers. Police violence is probably the most unsophisticated tool that the state has to fight crime or to uphold social order. And we have said this many times, that compliance, or rather cooperation rather than compliance, is the way that you get citizens essentially to follow the rule of law and to follow the responsibilities that are laid down in our constitution. To this end, as Amnesty and I think with about 20 other organizations, we did submit a set of 7 guidelines to the Inspector General on how to do distance-conscious and human rights-based policing during this period. So this is an area that we are actively involved in and will continue to be, I guess, engaged over this period.
But Mr. Irungu, there have been instances of police restraint, some of which you have referred to yourself, where police have demonstrated courtesy, kindness, and just general helpfulness to the rest of society. Do these pale in comparison with acts of, compared to acts of brutality and unkindness by the police?
I think, I think it's important not to generalize. I think we have over 120,000 police officers. Most of, even if 50% of them did, acted unlawfully and with excessive force, we would have a much bigger problem on our hands. What we have seen is really the actions of a few officers compared to the 120,000. But the concern still remains. I think the number of complaints that we are receiving, as Amnesty, we receive probably 1 or 2 complaints every day, suggests that there is a cultural problem, that there is a cultural challenge with police officers thinking that they can extort bribes from civilians, that they can brutally assault people walking home from or trying to get home to their loved ones and their families during just before curfew, or even if they get caught outside of curfew trying to get emergency medicine for their families or their loved ones, or even if their employers delayed in releasing them. So I think the point to be made here is that our concern as human rights organizations is always with violations. It is not necessarily the case that we would say that the entire reputation of the police service is at stake, but I think without prompt action by the Inspector General and by the regional commissioners and the regional commandants, we will not see the command responsibility that is required to keep people safe and to reduce these numbers. These numbers are high by any democratic society. They have to be brought down.
So in your view, how best can this be done under the circumstances that we find ourselves in, when there is no cure, governments are panicking, they think that if you don't flatten the curve, whatever that means, our healthcare systems will be overwhelmed, and we can't just take care of the numbers of tens of thousands, even millions will get infected and need hospitalization?
Well, I think the first thing is to drop the idea that criminalizing people who fail to follow the public health guidelines at this time will work. 47 million Kenyans, 120,000 officers. There is no way you can police your way through a pandemic. All you can do is essentially do 3 things. One is to basically continue to communicate publicly what are the challenges that this country faces at the moment, and call on citizens essentially to act through their sense of obligation to their neighbors, to their families, to the nation as a whole, to observe these regulations, including curfew. And as Amnesty, we would really encourage people to observe the public health guidelines that have been announced and continue to be announced by the Ministry of Health. The second thing that would be very important for the police to drop is this idea that somehow mandatory quarantine centers can be used as detention facilities for people who break the curfew, fail to wear a mask, or otherwise infringe on the public health guidelines. I think this has been the most dangerous development of the last week or so. Unfortunately, I think we saw yesterday or the day before the Ministry of Health stating that other holding facilities will have to be developed that will observe the physical distancing guidelines, but that the mandatory quarantine centers are not places to detain people without trial by other means. I think if I can turn to the mandatory quarantine centers, which I think is a critical part of this question. We've had basically two waves of patients or detainees to these facilities. The first wave were those that came from outside. They were essentially people who wanted to come back but missed the deadline to come in and self-quarantine. The second wave is those that are locally infected. And the character of those two constituencies are greatly different. The first is generally people, not necessarily uniformly, but generally people who had a bit of disposable income. They were outside the country, they came back into the country and were able to make the choice between a private and a public facility. The second group are essentially people who have come into contact with people with COVID-19. Many of them are casual workers. They are from the informal sector, and they do not have even the 2,000 shillings a day that has been required in some of the public facilities for them to be able to go through the 14 days. And they definitely don't have the capacity to take their entire family into those quarantine facilities. So I think this is the big challenge at the moment. I think the concern has been essentially that the police then manipulated those facilities and have actually been using them to either as a threat in order to extort bribes or simply as a deterrent for those people that were caught without curfew. And I think this, again, I hope will be brought to an end with the Ministry of Health, I guess, announcement 2 days ago.
Yeah. So as someone who spends a lot of time thinking about this and reading about them, you perhaps are looking at other jurisdictions as well that are implementing similar measures as Kenya. So for instance, South Africa, the DR Congo, which have also implemented curfew directives. Are we any different from them? Are the outcomes for citizens any different? Is police brutality less compared to ours? Is there a more kind of humane approach to doing these kinds of things? Because as we said earlier on, governments are struggling. There's just no good way to do this. There's no playbook to speak. We're making it up as we go.
Yeah, I think this is a great conversation, and I think at a time like this, we have to read not just in a multidisciplinary way, but we have to read what's happening and listen to what's happening across the world. And I think there are some similarities and dissimilarities. Let me just go through some of them off the top of my head. I mean, the first one is, that Kenya remains a country that has largely retained a liberal approach to the management of the pandemic. We have not declared a state of emergency. We've not suspended the constitution. Our laws are still in effect, broadly so. Unlike those countries that have declared almost immediately, like South Africa, a state of emergency. We have not seen a systemic attack on the free press. We have not seen attempts to muzzle freedom of expression broadly across the society. There are cases of journalists who have been beaten while covering police violence, and there have been cases of people who have been arrested, but I think the numbers are fairly low comparatively to a number of other countries within our region, for example. We've not seen the use of the army on our streets, and we've also not seen, with a few exceptions, the destruction of public markets and I guess public spaces where people have been congregating. So in some ways, we are liberal comparatively to a number of countries, and we have to keep this approach as we go through the pandemic. I mean, just an ironic case, I listened to the, I was, as you said, face-to-face through a Skype call with the police spokesperson a couple of weeks back. But then I listened to the Zambian police spokesperson who, and I quote, I think I pulled this up just for us to say, who said, "We will flatten anybody we find on the streets that are not observing these guidelines." And she spoke extremely glorifying about the violence that the state would meet on anybody, whether they were COVID, a person with COVID, or a person without COVID. So Zambia, has a very different approach from other countries. I think what I'd like to also to see, to see in the Kenyan context is very consistent information briefings, responsiveness to social media uproar or mass media coverage of particular cases. We've seen reversals of policy. We've also seen uptake, for example, of recommendations that a number of organizations put through very early in the month of March to call for a 90-day moratorium on electricity disconnections, water disconnections, the provision of water, and an acceleration of cash transfers to the elderly and people with disabilities. Even the conversation around the lockdown, if you remember back in March, a large number of people in the country were itching for a lockdown. They were calling on the government to lock down the entire 47 counties. And a small minority voice, in the public domain argued that a lockdown would be a disaster for a population of 85% who are in the formal sector. They have no way of protecting themselves, no way of social distancing, no way of staying at home, and no savings for them to be able to manage their way through a lockdown at this point. And I think it's great that the government has seen wisdom and has done a limited lockdown in many ways. Whether they'll be able to hold this or not is there. I think looking to the region or to the other parts of the world for examples of what we could adopt, which is another part of this question, I think, Alex. I think places like Lesotho and South Africa have retained school feeding programs, and children who are now at home have been facilitated to return to schools to collect food while managed within the physical distancing discipline that is there. And that has actually helped particularly low-income communities to manage the costs of additional mouths of children that have had to return to the informal settlements at this time. And I think the second point, and then I'll wait for another question, is really around, we need a formula now, a model, some new programming around self-isolation and home quarantine. The idea that we will somehow quarantine our way through mass quarantine centers going forward, I think is unsustainable. It's also not effective to expect people to pay for the costs of that quarantine. And this is one of the major sabotage, one of the major items sabotaging the mass testing that's taking place in Eastleigh and Kawangware currently. It's not that people don't want to test. It's not that people don't want to know their status. It is that they fear that if they are found to be positive, their whole communities, their families, the people they have been in touch with will be taken into mandatory quarantine centers, and they will have to pay for this. And I think that is what the governments of Nairobi, Mombasa, and increasingly so the other counties will have to contend with as a way of, a response. They need a response to this before we will see the mass testing being effective. I was in Kawangware on Saturday to talk to people, and I talked to both groups, those that were lining up to be tested and those that were watching and were not going to be tested voluntarily. And it's very clear that this is the point at which, the red line at which people are not willing to be tested. They do not want their family members to be quarantined at their own cost because they just can't afford it.
One of the things you'd expect with the COVID response emergency fund, I think, would be to set aside resources to then create habitable, humane kinds of containment centers for people who've tested positive or who've been found in the company of people who've tested positive, as we wait for the disease to either show up or for them to test negative. But moving on to the next question, Mr. Irungu, is the question of liberties. We've talked about violations, and that you've outlined that very clearly. But there have been instances, I think some of them are anecdotal. We've had reports from our judicial system of the spike in violence against women especially when men now are contained at home, can't go to work, etc. Does this concern you? And this personal safety question, it's not necessarily a rights thing, but there's a power dynamic when women are brutalized and beaten at home by their spouses or male relatives. What's your reading of this? And is this something that we need to pay attention to, have some kind of systematic assessment and get a sense of where this, because as you say, this is not the last pandemic, and we need to make sure that our homes are safe for our children, especially women in our society who are so often brutalized in other circumstances, but it seems like there's a spike in violence against women. Is your network picking up these kinds of violations as well?
Yes, it is. I mean, I think there is violence at various levels, and I think gender-based and household-based violence at this time, is shocking and requires, a degree of urgency to respond. And let me come back to slightly. Let me make a broader comment and come back to your specific questions, and maybe I can touch on some of the questions that have been raised by the some of the participants on the chat. So the first thing is that, the greatest danger, this pandemic is not the greatest danger to Kenyans. The greatest danger to Kenyans is the way in which power and privilege is exercised by the state, by men, by police and law enforcement agencies. That is the greatest danger at this point. And I think the concerns that we've had is, how do you maintain the constitutional freedoms and the rights that are contained in our Bill of Rights, and specifically the right to life, the right to dignified and appropriate and affordable medical health care, the right to housing, the right to non-discrimination. These are the critical fault lines of a society that retains a sense of democracy and safety for people, even during a pandemic. So I think the greatest danger can be found in how we exercise power and privilege at this point. A month ago, I wrote formally to government officers. I also reached out to fairly senior government officers, and I made two proposals to them. Both of them were denied or ignored. The first was that the curfew management and or the management of curfew should be patrolled or should be managed by a combination of law enforcement agencies, human rights organizations, and community leaders. And the thing I was trying to, as Amnesty, we were trying to press there, was that it would be much easier for a public behavioral change project to be managed by a range of different actors, particularly actors that have the trust of local communities already. The second request that we made was for the upstream national committees that have been set up under the National Emergency Response to essentially involve civic actors, humanitarian organizations, human rights organizations, community organizations, so that I guess a perspective could be introduced into the planning and the execution of these response strategies that would be bottom up and would have, I guess, an opportunity to see where they could potentially be hijacked or sabotaged. As I've mentioned, both of those proposals were rejected or just not responded to. Now, one of the things that I think we do need to do now is to retain, as somebody has said on the chat group, the capacity of people to monitor and the capacity of people to report to the institutions that have the capacity to document, legally enforce, and prosecute people either in the state or people in society who violate these rights. And I think this is an important, I guess, practical action that anybody can take. In some neighborhoods, the pandemic has given the opportunity for them to organize themselves in terms of street committees. My favorite example at the moment is a woman by the name of Mama Rahma from Kiamaiko Social Justice Center, She, very early on in the days after the killing of 13-year-old Yasin Moyo, patrolled the streets of Kiamaiko with the local police service officers, and we saw dramatically the violence reduce. In Kilimani, we have street marshals. Sorry, Alex. Sorry, go ahead.
So just some quick questions so that we can go and pick up the conversation with the audience. Two very quick questions. One is, you are on record to have supported a petition by the Law Society of Kenya to exempt lawyers from the curfew restrictions. I'm not sure what the thinking behind that was, but I can guess. But would you like to speak about that?
Yes, and actually, so Amnesty fully supported the legal petition by the Law Society of Kenya. 1 month before, as I mentioned, we made the same recommendation to the government of Kenya. We still believe that this is one of the ways that you can reduce the violence during the curfew, and also just ensure that people are getting the assistance that they require. Whether it be spouses that need to be separated, they need to have P3 forms and their injuries documented, or whether it be simply medical doctors that have to travel back and forth to tend to emergency cases. There is absolutely no reason why practicing advocates should be omitted from this list of critical and essential services at this time.
Okay, the last question before we turn to our audience is countries that have successfully flattened the curve, China, South Korea, and now more recently Singapore, they have instituted far-reaching intrusive measures using technology, especially for contact tracing, and for even creating what they call green, orange, or red, where you can't leave your apartment if you have been exposed to COVID. What is your sense about this in the context of personal liberties and just privacy?
I mean, to date, the Ministry of Health and the National Intelligence Services and the Ministry of Interior have essentially used targeted surveillance techniques. They are accessing our phones and they are using them to track contacts of people who have come into people who have come into contact with COVID, persons with COVID-19. So in that sense, the surveillance has started. Of course, it is very far from the Chinese model or the South Korean model. I think the Singaporean model has been an interesting one, because I think it has been able to do, to have a similar impact, but essentially using more voluntary means, like, for example, the adoption of Bluetooth technology that citizens are requested to activate, so that should they fall sick, they could easily trace back to all the people that they came into a certain radius with. And I think that model would be, if we're going to move in that direction, would be a better model to move to. Lastly, I think we need to ensure that any health surveillance or observation measures, including the keeping of personal records, that these measures are actually consistent with the Data Protection Act of 2019 that was passed last year. And I think we need to be sure that the use of this data and the storage of this data is justifiable. It is going to be used for legitimate public health purposes and nothing else. And then lastly, that the collection of this data will be time-bound. It will only be used for the period of the COVID-19 pandemic. And secondly, that those records will be deleted after the pandemic, because the right of individuals to privacy is paramount at this time also.
Thank you very much. I'll turn it over to Joki to then moderate the next session, which is the interaction with the viewers and audience from all over the place.
Thank you. Thank you, Irungu, for the great insights. Feedback and questions are coming thick and fast. I'd like to start by reading some comments and observations. The first observation is from Sheila Masinde, the Programs Manager and Acting Executive Director of Transparency International, that's TI Kenya. She says, great insights from Irungu. Authorities need to adopt a rights-based approach in all facets in responding to the crisis. National and county response initiatives should include representation of human rights organizations to enhance rights-based thinking and prioritize the needs of different groups of the population. That's from Sheila Masinde. We have a question here from Joanne Jaro, who also has a similar question to Thomas Muredi. Joanne and Thomas are asking, from a press perspective, how do we ensure that we hold government accountable for the numbers that they're telling us? How do we verify, if you're told that there've been 26 fatalities, for example, how do we verify that that is the actual truth? That's the first question, Irungu.
Let me turn to the, let me deal with the first question. I think, first of all, just to say that I think the press in Kenya have done, on the whole, a very good job of keeping us informed and ensuring that we understand the different manifestations of this particular period. I wrestle, and I'm sure many of us do, with the sensationalism and the headlines with content underneath that bears no relevance to the titles and the clickbaiting that is done online. And I think, you know, there is danger at a time like this. I think one of the first, comments by the WHO Director General was that we must beware of the infodemic, the deluge of fake news and toxic information that is not verified. And I think, you know, at this time, journalists and their editors must be held accountable and must strive to keep accurate and truthful reporting at the center of all our media stations. There is a moment really for that to happen. How do we do this? I think we need probably two sets of things happening, but they're both, I guess, leading towards the same direction, which is independent monitoring, independent interviewing and documentation of cases, following up on fatalities, following up on the mandatory quarantine. I won't mention it on this webinar, but there are particular radio stations in the morning that I listen to because they somehow seem to have the pulse of the nation, and I find the interviews extremely, illuminating. So I think at this time we need as citizens to be clear, you know, who is doing, the best journalism at this point, and just follow those journalists. I have my favorite 10 or 15. But everybody needs to identify their 10 or 15 in order to do this. But independent monitoring would be great. As civic organizations and citizens, we also have a responsibility in this as well.
Right. The issue of mandatory quarantine. There's a question here from Nixon Orwa. He's asking, how do we deal with the requirement for Kenyans to take care of testing and quarantine costs when quarantine is over? 2,000 shillings, quite a big figure for most Kenyans who might not even afford monthly rent for the same amount.
So I think this is a great question, Nixon, particularly in the light of the revelations that up to 1 billion shillings of World Bank money was spent on a range of non-essential commodities like airtime and snacks for Ministry of Health employees. I think my concern has always been really that at this time we do not see either pandemic profiteering or mismanagement of very precious public finances that we have. And I believe this morning or in the next 24 hours, the Health Principal Secretary will be before the National Assembly to explain how the funding is being used. I think for me, it would be very important at this time that the government prioritizes free mandatory quarantine for a selected group of people, and maybe there would have to be some kind of an analysis done in terms of those that can afford and those that cannot. But I think at this point, you cannot go down the route of mass testing and mandatory quarantine unless there is a facility that's provided. It's either that or we need to have other systems where people can self-isolate and be held accountable and be tracked for that. Or we have home quarantine facilities for those that can do this. But I think to simply have the idea that everybody who possibly came into contact with a person with COVID will be taken into mandatory quarantine at their own cost is just not going to work.
But just a quick follow-up on that one, Irungu. Would it make sense to have people pay for this quarantine cost using their NHIF cards? Because this is a health-related confinement.
I mean, I think that's a great idea. The NHIF component has not been brought in yet. I think the other thing that could be interesting to look at is how much of the National Emergency Response Fund should be dedicated to this area of the response. I mean, I think we're not seeing some hard numbers in terms of mandatory quarantine. It seems that that is being overlooked at this time as well.
Okay. So there's a question here, a very interesting question from Vincent Kimutai, who is asking, on the scale of 1 to 10, with 10 being the highest and 1 being the lowest, what score would you give the Kenyan government reaction or response to this pandemic? So they put you on a spot here. You need to score the government.
So it's obviously a difficult response because the response is the government response is multifaceted. It's doing well. I would probably be better off breaking it down in terms of what do I think about the policing during this period score, what do I think about the public health response score, and the social protection score. But let me not complicate this particularly for the teachers out there and the students who like one score. I think I would probably give it a 7 out of 10, to be honest, and it may be a bit generous because I do think this is a complex pandemic. I have listened and watched and read how other governments are essentially comparatively doing so much worse than we are. In that regard, I am thankful, but of course for the family of Yasin Moyo, for the father that was killed on Monday during curfew in Mathare 4A, they would probably rank the government at a 0 because they've lost their loved ones. So obviously, depending where you sit, there will be different responses. I'm sure if we asked the patients who went through the first wave of mandatory quarantine, or Echo, the musician, he would probably have a much lower score. So I think the key thing for us is really remaining vigilant, remaining propositional, and also demanding that government, where it makes a mistake, it autocorrects very fast, and that secondly, it continues to be open about the challenges that it's having, so that many of us out here can support them with ideas like the idea that Alex has just given in terms of NHIF that may not be explored to date.
Great. We have a comment here from Mukhtar Abdi Ogle, who might agree with you, but might rate the government response at 9. Now, moving forward, you spoke about Mama Rahma of Kiamaiko Social Justice Center. And there's somebody who's asking a question on community health workers who are doing so much work under very little or no facilitation. They also have the difficult task to motivate residents in areas such as Kawangware who have more pressing needs like food or water. In the process, there's apathy from people, especially in those slum areas, as we have seen. What can be done to help manage these rising anxieties in such locations? That is a question from Masi Kaki.
Masi, it's a great question. I think the we say it, and I guess we've said it many times, that the health workers at this time are our heroes and heroines, or sheroes. And I think we have to continue saying that loud and find ways of supporting them during this time. They are definitely the front line of the pandemic. they can't stay at home, not because that they don't have homes that allow them to do that, but they just physically are out there, often doing shifts of 8 to 10 and even longer hours. I spent an hour with the public health officer for the sub-county of Dagoretti on Saturday, as she basically rolled out the mass testing and fumigation in Kaungware. And I have to say, I'm just left with admiration. Here you have people who had no clue that the pandemic was coming. They've had to skill themselves on the measures that are required. They've had to essentially go into communities, like you say, that are frightened, that are anxious or apathetic and disinterested. And like you say, they have a hierarchy of needs that don't see the pandemic at the top of them. They also have, very few protective, gloves and masks. I mean, this is the thing that we have to keep reminding the state, that we are sending police officers, health workers into communities without the tools that they need to keep themselves safe. And what does that mean for an individual health worker to have to go home and not be able to hug their children, or to be able to bring their work home, or even just to face the stigma and the discrimination in their own communities for being a health worker this time. So I think in many ways, communities can join any of the fundraising and resource mobilization efforts that are happening. I was horrified by the temporary ban on giving that was introduced by the Ministry of Interior, and made our views known on this. It would have been a disaster, not just for the government response, but for the national response. At this time, we have to develop higher levels of compassion and solidarity for our health workers.
Thank you. So we have an interesting observation and question from Mariga Thoithi, who is saying, in petition number 329 of 2014, Justice Mombin Goge directed that section 27 of PHA does not authorize the confinement of persons suffering from infectious diseases in prison, includes other isolation facilities for the purposes of treatment. He even shares a link, and he asks the question, so on what basis does the government of Kenya forcibly placing people into quarantine? So what is the basis of the government forcibly placing people into quarantine? But there's a rebuttal from Michael, who says, if not for military or forceful actions, who can the Kenyan government trust to aid in mobilizing change behavior within a short time? So these are two very conflicting perspectives. I wonder how you can answer that.
So the answer to the second part, I think, is the government will win. All governments will win against the pandemic if they approach it from a whole of society approach. That they are inclusive, they are honest, they are transparent, they are mindful in the way that they use public finance. That's how governments will win and come out of this pandemic with higher approval ratings. So that's the first response. I think in terms of Mariga, hi Mariga, one of the things that has to, cannot really be wished away is the public health guidelines that were released by the Ministry of Health about 3 or 4 weeks ago. As Amnesty, with KELIN, the Kenya Ethical and Legal Issues Network, we submitted memoranda on those public health guidelines. We were not completely convinced that they would essentially be an effective response to the pandemic. We submitted our recommendations on a Friday by 10 o'clock, which is the deadline by which the deadline we were given for submissions, and we read the gazetted guidelines which had no changes whatsoever. None of our comments or the comments of other organizations that we are aware of that had submitted recommendations were incorporated. Those guidelines were simply released 3 or 4 hours later. So there is a question about the public health, public participation in a time like this. But I think one of the points of integrity is if you say that you will take submissions up until 10 o'clock on Friday morning, then those submissions must count. They must be considered. What you do with them after that is not the responsibility of the public, it is the government. But I think the public health guidelines now supersede Justice Mumbi's ruling, at least at the level of the effective, I guess at the level of the executive. But I think there is a bigger question. And the bigger question is this: we know the danger of this pandemic. We have seen the spikes in places like Italy, the US and the UK. We've seen the devastation in places like China. We know that our health system is ill-equipped to be able to manage this. The question I would ask citizens and civic organizations at this point: do we want to challenge the concept of isolation and quarantine, or do we want to make sure that the isolation facilities and the quarantine facilities are dignified, that they are accessible, and that they are affordable or free to the people that require them at this time? And I think for us, it would be the latter, the emphasis where we would focus our energy at this time, because the danger of challenging the government on this one is that we have no alternative way of dealing with isolation of people who may be carriers or may have COVID-19 and the capacity to transmit to others like you and me.
Great. Faisal Jaraj is asking, why is mass testing not being taken seriously, supposedly, I think, by the government, knowing that it will give us the true picture of the spread? And as you answer that, I'd like you to think about a very interesting question here. Do you think COVID-19 has been a disaster for feminism? So that's a question from Boro Muravori.
So as a feminist, I have to respond to the feminist question first. So no, I don't think it's been a disaster for feminism, nor has it been a disaster for Pan-Africanism or any ism that believes in the safety, dignity, and the equality of opportunity for all. I don't think it's been a disaster for the belief in that. What I think it has been a disaster, and I think this is where you're pointing to an important direction, it has been a disaster for some of the gains that we've seen in terms of reduction of gender-based violence, exclusion, stigma, and discrimination of people on the basis of their health status or on the basis of their gender or geographical or their class status. And I think the pandemic always had this capacity, and it's ravaging poor and Black neighborhoods across the United States of America, the United Kingdom, the elderly and those that have pre-existing conditions. This is the real character of the pandemic, is to go after those that are vulnerable. And it's a time like this that I think the nation needs to rise up and say that we have a philosophy and we have a belief in a country that does not allow its vulnerable to be targeted by a pandemic like this. Nor will we allow any government agency or any civilian or any citizen to go after vulnerable people at this time. And that's the response that I would give to the feminist question. On the issue of mass testing, I think there were two problems. The first is that we didn't have the agents that were required to roll out the mass testing. I believe this to be so, partly because Dr. Mercy Courier has told us so, and she is somebody that I follow closely. I'm not plugging for her, but if you wanted one of my 10 people to follow during this pandemic, she would be one of them. The second problem has really, I think, and I mentioned this at the beginning of the call, has been really the fear that if you bring yourself forward and you test positive for COVID-19, you will go into a government facility. And whereas you may not be worried about that because you will get the treatment that will allow you to recover. And let's remind ourselves that COVID-19 is not a death sentence. Many, many more people recover from COVID-19 than will die from it. Your fear is that everybody you have come into contact with, including your family, your friends, your extended relatives, the people you bought bread from, those people also could be traced and taken into a government quarantine center and have to pay for the cost of it. I think that's the primary cost. It's the primary fear that people have of not coming forward for testing. And I just hope the government can quickly respond to that anxiety and allow for people to come forward, because that's the only way we will know what the figures look like.
But Irungu, there seems to be a contradiction here. The measures which we generally refer to as non-pharmaceutical interventions, self-isolation, self-distancing, some partial measures of lockdown, these seem to privilege the wealthy and the well-to-do. When you look at who the disease is ravaging, especially with examples from North America, for instance, especially Black, Hispanic, Asian neighborhoods, and when you come to our country, there seems to be a pattern now. We've isolated and we're trying to lock down and mass testing in Kawangware. We saw numbers spiking in Dandora. And when you look at the measures that our government is trying to institute, the privileged segments of our society can work from the safety of their homes. They have all the tools that they need. They have internet and they have safe, they have places in their houses that do not encroach into family spaces. What are we trying to do here? So doesn't this, if you wear your Oxfam hat, what does this play in the realm of inequality?
Yeah, that's great. Thank you for reminding me of the Oxfam hat. I'm sure if any of them are on the call, they'll be very happy. I think I put it very far, but no, I mean, I think I started off by saying that inequalities is one of the major axes that this pandemic will, will fall into. And we started off, if you remember, in the first few weeks with really a one-size-fits-all adoption of the WHO guidelines, and quickly it became clear that physical distancing, washing of hands, these are all measures that need a certain infrastructure and a certain capacity to be able to implement. And fortunately, we caught ourselves in that moment, and we've seen a shift in terms of some of these procedures. I think the decision not to lock down was primarily driven by a pro-poor consideration. I think the second thing that we've seen is to essentially provide for testing and treatment in areas that have high numbers of people living in poverty or with high incidences of poverty. And that's why we would support mass testing for Kibra, Kawangware, and I think and Eastleigh and Kariobangi and the other places that we've seen this beginning to roll out. We would be against privilege testing. We watched very carefully as Amnesty the move to test members of parliament. We worried that that would extend to their families and to their friends and anybody who could bribe a public health officer. So, in many ways, I think we have to keep an eye on the bulk of our people who do not have the social safety nets that exist in places like Karen, Runda, Kilimani, and other places. And I think that's the focus. The state violence has not been in Runda and in Muthaiga. It is in places like Madari and Dandora. And we have to continue to demand that the rights of all people are protected during this period. But if we have to prioritize government resources, they have to be for people who live below the poverty line or are grappling with essential services as we speak. So that I think I would just respond on that way. We have to resist the knee-jerk reaction to close people's markets. We have to resist the temptation to have discriminatory approaches to restaurants opening. I think this is one of the areas that I think we need to watch very carefully, is the decision to allow restaurants to open if they can afford the various licenses and the testing for employees. Many of the people that I met in Kawangware on Saturday were restaurateurs. They were waiters, security officers that wanted to be tested so that they could go back and show their employers that they have been tested and therefore could get their jobs back, including a couple of domestic workers who wanted those tests to convince middle-class employers that they can return to those homes.
I think you have alluded to an answer to Mariga Thoith's second question about what you think about restaurants being reopened. There's a question here from Hezron Owila, who says that authoritarian countries seem to be doing quite well in enforcing mitigating measures. So examples abound, and he wouldn't want to mention some names with a few strong men with little democratic credentials. Do you see a potential risk to liberal and participatory democracy as we know it today?
Yeah, that's a great conversation, I guess.
How the strong men responded, yeah.
Great question. Autocratic or democratic responses, which has worked best? I mean, I think there is elements of success in both. And there is also elements of profound, staggering failure in both. Let me just give you an example. China withheld information about the COVID virus for several weeks. They arrested and prevented whistleblowers from speaking to the press or even from raising enough public attention so the public health initiative could be developed. And then you've got the United States of America, where the right to demonstrate is now being used to essentially push back against federal public health guidelines. And you have a head of state that is promoting that behavior. So, I mean, we have an interesting set of responses. Maybe if I could just confuse the mix a little bit. Actually, the true picture, in my opinion, not Amnesty's position, is that governments run by women are actually doing much better than governments run by men. And at that point, I would just say discuss.
Great. Okay. So last question. We're running out of time. Dr. Anthony Jogona Maderi is asking a similar question to Mariga, who I see has another question, asking about economic recovery. What are your thoughts on economic recovery as we move along?
So I'm not an economist, and Amnesty doesn't profess to have even a human rights based economic approach to COVID. So this is a presentation. This is a question for one of your other great presenters that is coming on. But I think for us as Amnesty, we've appeared before Senate, the National Assembly, and we have, been at pains to make sure that social protection measures are at the heart of the stimulus package that the government announces. One of the things that has been interesting for me is in the tax breaks that were given to employees that came into effect at the end of this last month, or this month actually. One of the questions that I asked myself and have not asked my colleagues and kind of compatriots within the human rights movement is, now that we're getting X percentage back from the Kenya Revenue Authority, would we like to gift more deserving communities, more deserving households with that amount, rather than essentially it's just going back into our disposable income during this period? And I think the question for me is, and it's a question that's being raised globally. I mean, I think there's a raging debate in the United States of America, the extent to which tax breaks essentially affect large corporations, but have very little impact on migrants, refugees, poor people, and the unemployed, and those who are losing jobs. I belong to a community effort in Kilimani, and we have just begun thinking about, how to provide support for cleaning people, women and men who clean homes in our neighborhood, and domestic workers, and also security officers that have lost their jobs during this time. And I think, if any of the viewers, any of your viewers and any of the participants on this call are not part of some giving strategy, then I would just urge that they do this, because that is the way that we keep those that are most affected by this pandemic at the center of our response, and don't allow for others to profit or to even expand their businesses at this point.
Okay, as we finalize, I'd like to read two comments. There's one from Catherine Muhatia, a journalist, who says journalists should not just rely on numbers, they should give meaning to the numbers. Abdi Ogle says that there's an urgent need to work on the disposal of masks. Many struggling citizens in the slums are seeking dumped masks and washing to resell in the streets. Public sensitization and mobilization. Yeah, thank you very much.
Ladies and gentlemen, this brings us to the close of episode 3 of the Understanding COVID series, brought to you by the Graduate School of brought to you by the Media Innovation Center, located at Aga Khan University and hosted at the Graduate School of Media and Communications. Thank you very much, viewers and listeners, and a special thanks to our guest, Mr. Irungu Houghton, Executive Director, Amnesty International, Dr. Alex Awiti, Vice Provost and Interim Dean of the Graduate School of Media and Communications, and Ms. Njoki Chege, Director of the Media Innovation Center. Join us next week for episode 4 of the series, where we will host special guest John Githongo, CEO of Inuka Kenya, where we will probe the topic, should governments be held accountable on the use of COVID-19 pandemic resource funds? Please, ladies and gentlemen, do not forget to follow us online on our Facebook and Twitter platforms at AKU Media Futures. That is AKU Media Futures. Once again, thank you and have a wonderful and safe afternoon.
Irungu, thank you very much.
Thank you.
Thank you very much. Enjoyed it very much and look forward to watching the other participants and resource persons.
Thanks.